Novel coronavirus is not going away during flu season, and that makes getting your annual flu vaccine more important than ever. Getting the flu and COVID-19 at the same time, or one right after the other, can be devastating. Hello, everyone. I'm Susie Lowry Hall. I'm Enloe's Community Outreach Coordinator, and I'm here today with two guests. I'm here with Jenny Kasza, a registered nurse at Enloe's Endoscopy Clinic, and Margie Rackley, a program assistant at Enloe's Outpatient Center, to talk about this topic. But before we get started, please remember that the information we're about to share is not intended to be medical advice. If you have specific questions about the health of yourself or a loved one, please talk to your provider. And as always, feel free to post your questions in the comments field, and we'll do our best to answer them as many as possible throughout the broadcast. And so with that, let's get started. So Jenny, we're going to go ahead and start with you. So thanks, Jenny, so much for being here.
Thank you, and I appreciate you having me here to talk about Enloe's free flu shot clinic for our community.
Absolutely. So when does flu season kick off and how long does it go?
Well, the flu virus is actually in our community year-round, but it taps down in the spring through the summer and then ramps up in the fall and the winter. So end of October, we will start seeing more and more cases, and it peaks in December through February, but actually can last for a while through the end of May.
So when should folks get their flu shot?
Folks should get their flu shots by the end of October. It actually takes 2 weeks for the vaccine to develop your antibodies in your body, so you want to plan on that when you plan to get your flu shot. However, if you miss that end of October deadline, please go ahead and continue to seek out getting a flu shot.
Great. So who needs one?
Well, most everybody needs a flu shot. People who are from a baby 6 months old through adulthood should get a flu shot if they meet the qualifications for that.
So what flu vaccinations are available?
There are some different flu shots available. The flu shots come in generally 3 different types. The first type is the flu shot that we give at the flu clinic. And at our clinic, we do not give to babies or children under 3 years old. If you have a child under 3 years old, they should not come to the clinic. They should seek out and go to their primary care provider, like a pediatrician, who's ever their healthcare provider if they're under 3 years old, because we do not provide that for children under 3 years old. There is also a nasal spray flu vaccine available, and that's for people 2 years old to 49 years old. We do not provide that for people. However, if you want to seek out in your medical community where you can get that, if that's something you're interested in, there are some limitations for that, and you have to reach certain health parameters to qualify to get that vaccine. The second type of vaccine is for people ages over 65. When you're over 65, you have different immunity responses, and that's a more concentrated dose. That dose of vaccine should be available through your primary care doctor or pharmacy, and usually Medicare will cover the cost of that. The third type of vaccine is for people who are allergic to egg yolks. Egg yolks are used in the production of the general community flu vaccine, and so they have derived one that's special for people who have an allergy to egg yolks. Another type is available for pregnant women with no preservatives. It's our standard flu shot, but no preservatives in it. And our women's health clinic will have information about that, and it's in our flyer and Enloe website.
Are there folks who shouldn't get the flu vaccine?
Actually, there are some folks who shouldn't get a flu vaccine, and generally some people might have an allergy to the flu vaccine, and they would, maybe people who are allergic to some of the gelatin. And so if you have allergies, you should always check with your doctor. Any questions, please check with your doctor. Also, people who have some different health conditions like diabetes or heart or lung conditions. Some people have had an illness called Guillain-Barré syndrome. They should not get a flu shot. So always check with your healthcare provider before getting a flu shot to make sure you're a good candidate.
And then again, you remind us if they're under 6 months that they shouldn't be getting the flu vaccine.
Right. Under 6 months, do not get a
Okay, that's great. Thank you. So now let's go ahead and dig in. Why is it so important for folks to get their flu shot this year compared to other years?
Well, getting the flu shot helps keep you healthy and the people around you healthy. The children 0 to 6 months old, those babies need protection from the flu. And if you are protected and do not get the flu, you are not spreading it to them. You're not spreading it to older people in our community who have compromised, or just general people in our community who are not compromised. Also, this year, of course, with the coronavirus challenge, as you said earlier, Susie, that we need to be careful and prevent the flu in ourselves and others, because a person can have the coronavirus and the flu at the same time or back to back, and it might be really hard for your body to fight that and be devastating.
Wow. So what can people do to prevent the flu?
Number one, get your flu shot. Like the coronavirus, do the same things. Wash your hands a lot with soap and water. Cover your mouth and nose with your elbow if you need to cough or sneeze. And avoid people who are sick, and if you feel sick, please stay home till you're better.
That's really great. So you basically answered my last question, but if people come down with the flu, can you touch more about what they should do if they think they have it?
Well, if you have the flu, you should stay home and wait till you have a 24-hour period where you have no fever or symptoms, and also stay away from others. I did want to add that sometimes when you get the flu shot, as with other medications, there can be side effects. Some people say, oh, I've had the flu shot, it gave me the flu. Well, actually, that's your body working during that 2-week period to create your immunity. And that immunity, as it's being created, can look like the flu. You might be nauseated or have symptoms of a fever and various other things. But those symptoms are short-lived, usually 1 to 2 days. And you can be reassured that your body is creating a special barrier for yourself to be protected from the flu.
That's great. So I'm going to go ahead. Thank you so much for joining us. I'm going to go ahead and invite our next guest, Margie. So Margie, thank you again for joining us. Thanks for waiting.
Thank you, Susie, for having me.
So Margie, can you tell us, I understand Enloe has several flu vaccination clinics coming up. Can you tell us more about them?
Gladly. We are going to have our traditional drive-thru clinic at Calvary Chapel, which will be our kickoff. What's going to be different this year is that we're going to have 2 of them. So the first one is going to be on a Thursday, and it's going to be from 2 to 6 p.m. And then the following morning on Friday, we're going to do it again from 7 to 11, because we've really heard the community say that they want different opportunities to be able to attend a clinic.
So with the current COVID-19 pandemic, are there any specific guidelines folks need to follow when they attend in those drive-thru clinics?
This year with COVID, we have made them all be a drive-thru. And the drive-thru is exactly that. We've got a really good traffic flow set up for you. We have volunteers out on the street and inside the parking lot to guide you all the way. I'm going to give you a consent form and a vaccine information sheet. So please make sure to say hi to me. On that information sheet, hopefully it answers all the questions you might have. It's provided by the CDC. The consent form is very simple in that we just want you to legibly print your name and your phone number and your date of birth and answer some questions. As you go along the traffic pattern, you're going to get to our nurses, and they're going to review that consent form with you and make sure you're feeling well and appropriate to get your vaccine. And then they're going to give you a little pinch right here on your arm. So you want to make sure that you're wearing an appropriate clothing, and they're going to give you your vaccine, and they're going to send you on your way. If this was the first time you're getting a flu shot, they are going to ask you to sit in a designated area with a volunteer observing you for 15 minutes to make sure that you're safe to be on the road. And the other thing about our flu clinics, Susie, is children. We have a lot of them come through. We have pediatric nurses there. And if your child is under the age of 9 getting the vaccine for the first time, we're going to give you another information sheet, because we want your child to come back and get their booster. And this is the only year they'll need to do it. And we try to keep them really happy and give them some type of a sticker or a sweet treat as they leave.
You mentioned that it was a drive-thru. So are walk-ins an option?
For your safety, we preferred not to have you come in as a walk-up. However, both of our host locations, Calvary Chapel and Elks Lodge, do have bus stops nearby. So we will not send you away, but we do ask you to be extra cautious. And if you just approach me and you get your consent form, then I'll be able to guide you to where you could safely walk up to a nurse.
That's great. So with the current COVID-19 pandemic, are there any special guidelines folks need to follow when they attend Enloe's drive-thru flu clinics?
We're going to ask you to follow the same guidelines that we're having to follow right now, and that is to don't come if you don't feel well, to make sure that you're wearing your mask. And in fact, if you're not wearing a mask, unfortunately, I'm going to ask you to leave and come back later with a mask. The mask is to keep you safe, and the mask is to keep our nurses and our volunteers safe. So a mask is very, very important. And again, if you're not feeling well, we ask that you don't come and get your flu shot that day. Remember that we're going to have multiple flu shot clinics this year, and when you're feeling better, come to a different one.
That's nice. So where can people go to get information about the flu clinics?
We have a website that is updated as soon as we receive our vaccine from the county, and that is www.enloe.org/flu. And we will update that with all of the dates, times, and locations as soon as we can post it.
This has all been really great insight. Thank you both so much for being here today. Is there anything else you'd like to share before we wrap up today?
I'd really like to thank our community. I'd like to thank them for supporting us, for coming out, for getting their flu shot to keep everybody else healthy. This year, it's going to be especially important to make sure that you get your flu shot because the symptoms are similar to COVID and we don't want to be confused, and we want to leave our hospital resources for those who need it more. So if you get your flu shot and you help prevent getting the flu, that's the first start to that. I also want to thank the neighborhood over by the Elks Lodge. This is the first year we'll be doing that as a drive-through, and we really appreciate your patience. And we just ask that the community members who are attending that flu clinic make sure that you drive slow and careful, watching for driveways and people who might be leaving their homes.
Thank you so much. That was great.
Thank you for having me, and stay safe, everyone.
Well, I, along with Margie, also want to thank you for coming out to get your flu shot, whichever way you can get it, and just keep helping our community stay healthy. We really appreciate everyone's involvement for that. Thank you very much.
Thank you both again for sharing all this great information. It was so informative. And thank you for watching. Join me for our next Facebook discussion in October as we discuss breast cancer for Breast Cancer Awareness Month. But until then, please make sure you get your flu vaccine so that we can all stay healthy and well together. Take care.